Hello, this is Georgie Oldfield, physiotherapist and founder of Serpa. In this video I want to focus on low back pain and how the concept behind the Serpa approach differs from the conventional beliefs about the cause of chronic low back pain, which is great because actually this means that there may well be an answer to your pain rather than just the conventional belief that you'll only be able to manage it and learn to live better with your pain. I personally began to question the general beliefs about a physical cause for chronic pain many years before I came across the concept on which the Serpa approach is based. And this was because there were too many things that didn't quite fit. For example, so many people would wake up with pain and they couldn't place it on any particular physical reason. Often pain would come on while they were doing something completely innocuous or something that they would normally do without any problem. It didn't seem to matter what their structure whether it was like in their spine, whether they had slipped discs, some sort of spinal degeneration, whether there was any muscle imbalance, whether they were overweight or too slim, or it didn't seem to matter any physical reason as to whether they developed pain in the first place or whether they managed to resolve the chronic pain. And often patients would resolve chronic pain through my very gentle treatments, despite the fact they still had this what appeared to be spinal degeneration on their MRI scans or a slipped disc, something that I know through my very gentle treatments I wouldn't be able to resolve, and yet their pain had gone. And there were also numerous people where it was just medically unexplained. They had non-specific low back pain when no cause could be found. So there seemed to be no correlation between all this. In fact, when you look at the research, you can see that there actually is no correlation between pain and posture, structure or biomechanics. I'll put a link to the paper, to a paper that brought all the research together over the past 20 years about this, and this is what they concluded. There's also studies since the 1970s showing that spinal degeneration on MRI scan again has no correlation between whether somebody has pain or not, because just as many people who have spinal degeneration don't have pain. So actually coming across this work for me was like an epiphany, and it made me realise that there was another reason for the pain, and therefore now by dealing with the underlying causes we actually get to the point where we can help patients recover from their chronic pain rather than just manage it. The pain and the other symptoms associated with chronic low back pain are actually created by the brain and the central nervous system as part of our unconscious and automatic protective stress processing response. And unfortunately, the pain becomes learned, so the nerve pathways related to this all become learned, and we become conditioned to have the pain. And unfortunately, this is then exacerbated by our fears about the pain, what we can do, what we can't do, the diagnosis, and our focus on the actual pain. But the exciting thing about this concept is that once this is recognised, because this process is reversible, when we deal with the underlying causes of the stress, actually full recovery is possible. And the Serpa approach uses a self-empowering and often self-directed approach using education and various strategies to actually help people not just acknowledge and deal with the underlying causes of the pain, but actually help them with strategies to resolve the pain and remain fit and healthy in the future, because we're teaching them to deal more effectively with stress that they have in their lives. So as the Serpa approach is very much based on education and understanding this, why not actually go and find out a bit more by downloading the Serpa Recovery audio recordings and learn a bit more about this and see how much you can do to actually progress on your own journey. Take a look, and if you're interested, do get in touch and see if we can help you actually fully recover and regain your life.